there, horse peeps. Chris Garrett here, Parker, Colorado. So for those of you who know me, you know that I have a wonderful mare who got tangled up in the fence and has a horrific hind leg injury, lower leg, where the circulation isn't great. The skin is mostly dead now on that leg. I'm starting to get proud flesh, and it's looking pretty nasty. But I had learned years ago a little trick to help with proud flesh. Let me say I am not a vet, never have been a vet, but just play one on TV. So ask your vet before you do this. But this is a technique that used to be considered an old wives' tale, but people would swear by it. But there has been a lot of research done on it, and it has been discovered that the amnion from a mare from a birth is actually filled with stem cells. And the idea is if you put the amnion on an open wound, the stem cells in the amnion will help heal that wound. So there's a lot of people who don't believe in this, but I have even talked to vets who do believe in this. And it's a cheap fix if you can get a amnion, which bless Brad and Nicole down at Premier Breeding in Kiowa, Colorado, there was a mare that just foaled, Robin, hi, and she donated her amnion, not the placenta. The amnion is the translucent white covering that is closest to the baby, and that is inside the placenta. So you remove that translucent, we'll show you what it looks like here, and we'll cut it up into bandages. We'll put it into wax paper on layers, and then we're going to put it in the freezer so they'll keep, because this has been refrigerated. It's been in a bucket in a very cold barn, so it's been very cold and it's still real fresh. And I'm going to show you how to make amnion bandages for your horse. Okay, so let's roll up our sleeves. We have our gloves, and let's get to work. I'll cut the sound out of that. So the first thing I did was boil a bunch of water, and just to make sure there's nothing in there that in the water, because you just never know. I'm on a well, and I'm pretty confident my water is clean, but it's certainly not sterile. And this is not a sterile operation, but we do want it to be real clean. And you can use a lot of different products to wash the amnion. You don't want anything too caustic, because we don't want to kill the stem cells. But you can use betadine or Novosan. I'm using Hibiclens, which is a human pre-surgical scrub that does kill bacteria. So I'm going to wash the amnion, dip it in water that's been boiled with a little bit of Hibiclens in it. So Brad nicely packaged this for us. Double bag. So this is what the amnion looks like. This has got, of course, a little bit of hay in it, which is perfectly normal. It's that kind of translucent. You can see the veins in it. We're going to wash, get the little bits of hay. It's almost pristine. Brad did a great job. Thank you so much for saving this for me, Brad. So you can see there's still some blood here. There's a few little things. We'll cut those things out. Here's what it looks like. And I want to make bandages that are about the size of my mare's wound. So you can see how this probably was in one of the horns. It's shaped the same as the placental horn. So I'm going to cut, her wound is about, I would say, 10 inches long, so I'm going to cut a little bit more than that. Wow, that is slippery stuff. Okay, so I've got my piece here, and this is double layered. So I'm going to open it up, and then I can wash the inside too. You can see it's actually very thin. You see that? So I'm going to cut that in half. Normally when I would make these, I'd make them like 6 by 6, but my mare's wound is so large that I'm going to make these extra large. But you can make them however you want, and you can certainly just freeze them for future use. We used to breed a lot of mares. We used to have 5 babies a year back in the day when we had a stallion. And so I would always save at least 1 full amnion a year, freeze it. This is where the blood's coming from. It's coming from these veins here. No worries about the blood. We will do another rinse. So now I have a piece that's about manageable for my mare's wound. You can, if you're just doing this, you might want to make them half that. I'm making mine extra large because of the wound. Hard to tell sometimes which side the little, I think are blood clots I'm seeing here that are kind of stuck in there. It's really slimy. Feels like an octopus. Where is it? So I'm going to dip it. Again, I don't want to use too much Hibiclens because I don't want to be killing stem cells, but I do want to kill bacteria. So you dilute it in the water that you boiled, but as you can see, it's really not a sterile event here. And we're not going for sterile, we're just going for as clean as we can get. All right. That seems to be inside the tissue, so I guess I'm going to leave that. There we go. Yeah, these are little blood clots up here. So that's what it looks like. You make them whatever size you want. I really have no idea how long they last in the freezer. I still have some in my freezer, but they're like 10 years old now. And I thought, wow, if I can get fresh ones, I would really rather do that. So I'm going to store them in this little tub here. This is not airtight, so I wouldn't store them very long in this tub, but I need something big, and all the airtight tubs I have are more like 6 by 6, but I'm going to be using these really fast. I won't be freezing them. I'll just be refrigerating them because I need them now. But if I was going to freeze this, I would get an airtight container. In fact, maybe I'll show you how to make those. So I'm going to put 1 little piece of amnion. Again, those are the little blood clots. They're all right, you can leave those. And I'm going to put a piece of wax paper in between each one, otherwise they do tend to stick together. And I don't want to do that. Hibiclens. Clean it off. That's kind of an odd shape, but that's all right. It'll still work given the wound I have to work with. And as you see, I could probably make 100 of these and put it for this bucket alone, because it's a lot thinner than you think when you get the whole placenta. Or I mean the whole amnion, not the placenta. Don't use the placenta. That's not the amnion. Some people who haven't experienced breeding or foaling out aren't sure what the difference is. And of course humans have these too. A baby that's born inside their amniotic sac used to be called a baby with a veil, and they were considered special. I think all babies are special. Especially mine. Okay, here it is doubled again, so I'm going to cut. This is kind of messy. Probably should have done it outside. I'm going to cut this. leveled. And I want to get to that other. See, I got a couple pieces of hay here. You can do some rinsing as well. I think if I had another big bucket here, I'd probably rinse it again in fresher water. In fact, I think I may do that. Okay, so I got another, I'm just putting a little tiny bit of Cleanse in there. I want to rinse this off in something fresh. Yeah, because there's still a little stuff in there. I'm trying to find that little teeny piece of hay. And I need to find the opening. There we go. Now I can get that off. There we go, yeah. Alright, that's a pretty big piece. I'll probably cut that in half. It's slimy to deal with. Right, it's a nice one. You use a lot of wax paper, so get a big roll. Again, we're not trying to be sterile here, but just clean. If you're at the point of having proud flesh, your wound is probably pretty sealed up. There we go. All right, another piece. So that's basically it. Just to give you an idea, I will just keep doing this. It'll probably, gosh, I'll probably get 30 to 50 bandages out of this, even this big a size. So, you know, if you're just doing this for your own use, you might do a small box just to have on hand. Again, I have no idea how long they will last, but I know I've given them away as much as 3 years old, and people have been very impressed with how well it works preventing proud flesh and helping the horse heal. Now, I did talk to a vet today about this, just to make sure there wasn't some new study that I hadn't heard about, and she was very supportive of me doing this. You know, there are chemical applications now for proud flesh, and she said put the Amnion right next to the open wound. You can put it on the proud flesh too, but don't put like a proud flesh retardant chemical on first and then the Amnion. Put the Amnion first and then use the other one on top of it, because we don't want to lose. I didn't put a wax paper. We don't want to lose the stem cells against the tissue, because that's where the magic happens. But she said if you're concerned, like, or if you have an infection, you can just use white sugar of all things. White sugar works real well, and non-pasteurized honey directly on the wound, and then the Amnion on top of that, and it won't interrupt the stem cells helping with the wound. But the other, you know, the other harsher chemicals, she believed were a little bit caustic, but you know, they are designed to stop the overgrowth of proud flesh, so they have to have something that will hold that back a bit. But that, you don't want that on there and then the Amnion. Put the Amnion first, maybe put that other stuff just on the big proud flesh after your Amnion treatment. That's a little odd shaped. I'm not sure I want that big old tail. It's hard to tell how. Oh no, see, look at how that will, look how transparent that is. Can you see through that? You can see through that? It's amazing. I think I better clean my water here. This is kind of messy. Again, not going for sterile, just clean. But the heel cleanse will help with the keeping it from growing any bacteria. Just help. All right, so this is going to take me a while. You probably don't want to watch this whole thing. So I will be here for a while cutting amnion. And this stuff really works. Give it a try. Store it in your refrigerator. And if you know somebody with a really bad lower leg injury, because there's just not good circulation down there, tell them about this. Give them your box of amnion and go make a new one when you have your next foal. So thank you for joining. Hope that helps. And I'll keep you posted on Tara. Hopefully she's going to be okay. Thanks. Bye.